Hello physios, I welcome you all to our channel Physio with David. We are back with our next lecture on ultrasonic therapy. So now we are starting the physical and physiological effects, okay? And it is slightly lengthy but easy to understand and most important part of ultrasound. We will be studying about thermal effect, non-thermal effect and the mechanical effects. Okay, so first of all we will study about the thermal effect. The thermal effect are, first is local, okay, and second is the neurological effect. So local के अंदर जो हमारा पहला है, it is the cellular effect. Okay, cellular effect. As we are studying about the thermal effect, we have studied the Van Hoff law. So whenever you have to write the cellular effect of heating, any heating modality, Van Hoff law. Van Hoff law. And what does it state? It states that metabolic activity is directly proportional to temperature. So whenever there is the application of ultrasound on any part, the metabolism will be increased because of the increased temperature, because we are studying the thermal effects. And as the temperature increase, the metabolic activity increase. That is, the demand of oxygen is increased and a lot of metabolic waste products are also produced, which are removed. Okay, so which is the cellular effect. Okay, and this is the first thermal effect under the local effect. Second is viscosity. It is simple, as temperature increase, then viscosity decrease, and it is the viscosity of our blood. Okay, blood and body fluid. Okay, so as temperature increase, the viscosity will be reduced. Then blood flow, as the temperature is increasing, it will cause vasodilation, so the blood flow will be increased and further effects are produced. Then on collagen, okay, so the temperature is increasing, which will increase the extensibility. Temperature increase, extensibility increase, okay, which is the effect on collagen. Okay, so this is the first thermal effect under the local heading. What are cellular effect, viscosity, blood flow and collagen. So next is the neurological effect. First is muscle spasm, or more appropriately the effect on muscle tone. Okay, muscle tone, you can write this thing in brackets. Okay, so this will, heating will cause the stimulation of Golgi tendon organ and will give the efferent via 1B fiber to the spinal cord, which in turn cause the inhibition of alpha motor neuron. Hence it decreases the tone, so reduces the spasm. Okay, so next in the pain, for example, this is the nerve which is having a nociceptive information or nociceptive stimulus. Okay, and it is carrying the lower one. Okay, lower one. This nerve is having a nociceptive stimuli. Nociceptive stimuli and carrying the painful stimulus to the spinal to the brain. Okay, so this is the spinal cord. But if we give ultrasound, okay, ultrasound which will produce heating of the tissue, it will cause the inhibition, okay, by the release of GABA, which is a inhibitory interneuron. Okay, so this collateral will give us GABA, which is inhibitory neuron, which will inhibit the pain pathway. That is, the pain gate will be closed. Okay, and next part is tissue healing. All these things, that is, blood flow increase and metabolic activity increase, that is, fresh oxygen will come. Okay, nutrition will come, which will promote the tissue healing. And last is muscle performance. As the extensibility is increasing, the range of motion is definitely increased. and research have stated that whenever we give the ultrasound, there occur increase in the performance, that is muscle strength increases, so we can say muscle performance increase. Okay, so these are just similar to the physiological effects of heat. Okay, so I have just explained you these things in a brief, because we have already discussed this pain gate theory is already discussed. So till now we have completed the thermal effect. Okay, in the ultrasound topic these effects are written in a paragraph. Okay, so there is one line, but I suggest you to make points like this. Now we are going to study about the non-thermal effects. Okay, so there are total 4 non-thermal effects. First is cavitation, second is acoustic streaming, third is standing wave, and fourth is micro massage. Okay, so you need to just focus on the 4 diagrams to have a clear cut concept. Okay, so first is cavitation. Cavitation is defined as the formation of small, that is the tiny bubbles. Why? Due to the vibrations which are produced by ultrasound. As we have studied, the metal front plate move back and forth due to the changes in shape of crystal. It will definitely produce vibration, and during the application these vibrations are transmitted to the skin, which cause the production of these tiny bubbles, and its size is 10 to the power minus 6 centimeter, which is very small. Okay, and further these are of 2 types. First is the stable cavitation, second is unstable cavitation. In the unstable cavitation, the size of the bubble is increasing. Okay, and after that there occur the implosion. Okay, after the implosion there is a lot of production of free radical, increase in temperature and pressure, which is definitely damaging, so unstable cavitation is not good for us. But if this bubble is not increasing rapidly in the size, but is having a small size, and it is very beneficial for us. Why? Because there occur micro currents around it, that is circulation of tissue fluid. Also these bubbles will move to and fro, which will cause the cell membrane to either push and pull. Due to this, the permeability will increase. Okay, so it will increase the permeability, which increase the diffusion of calcium, okay, other ions and nutrition, and further it will stimulate the cell activity, that is mast cell and the fibroblasts. Okay, so it is very beneficial for us. This is about the cavitation. Now what is acoustic streaming? This stable cavitation is associated with the acoustic streaming. Why? Because whenever there occur a stable cavitation, there is a radiating torque. Okay, and what is the meaning of torque? It is the rotatory force. So you can see in the diagram that this is the stable cavitation, and around this the tissue fluid is circulating, that is circulation of tissue fluid. So it is moving in circular direction because of the torque. And who produced this torque? Due to the vibration of ultrasound and to and fro movement of the stable cavitation, which will help the tissue fluid to circulate around the cell, which will again increase the cellular activity, increase the diffusion of the ions into the cell, such as calcium ions. Okay, so this is acoustic streaming. So you can simply say that the unstable cavitation is damaging, while the cavitation which is stable one is good for us in 2 ways. First of all, it directly increase the diffusion, increase the cell permeability, and second, it is associated with the acoustic streaming. And this acoustic streaming produce the movement of tissue fluid, which can be either micro streaming, that is the movement of the fluid around the cell. Okay, so definitely it will remove the metabolic waste and let the fresh nutrients come. Also it can be bulk streaming. Okay, in some cases bulk streaming, we cannot see the micro streaming but can see the bulk streaming, where the movement of the tissue fluid is occurring on a larger scale. Okay, so next is standing wave. I had already explained that how standing wave are produced. This is the transducer head and this is the skin surface. This is the skin surface. So when the incidence wave, that is this blue one, is going and it strike to the skin surface, and there occur reflection of this wave. This black one is the reflected wave, and you need to focus on one thing, that these two, that is incidence and the reflected wave, are in same phase. Yes, they are in same phase. They are in opposite direction. Yes, they are in opposite direction. Incidence wave is moving in this direction, while reflected wave is moving in that direction. Also amplitude is same. Due to this there occur constructive interference, and this larger blue one wave is produced, which is called a standing wave. Is it good for us? No, it is not good for us. Why? Because there occur a lot of harmful effects, which I will explain you. This part is called the node, while this part is called antinode. You can see I have written antinode here and node here. Okay, so this is the node. Gas bubble collect at node. These stable cavitation are the bubbles which collect at antinode, while the cells are collected in the node. What happened due to this? So you need to visualize this thing, that if the bubbles are collecting at the antinode and the cells are collecting at one place, that is at the node of the standing wave, this can further cause stasis. Okay, this can cause stasis of the flow, that is flow will be reduced, which can further lead to the formation of thrombus. Okay, and also it is associated with increased temperature and may cause burn. Okay, so this is about the standing wave. How it is formed? Incidence wave and reflected wave, both are in opposite direction, same phase, same frequency, same amplitude. Okay, which lead to which type of interference? Constructive interference. Cells collect at node, bubble at antinode. Due to the collection of cell at node, there occur stasis, because all the cells of the blood are collecting at the nodal area, due to which the stasis occur, and you know well that stasis lead to the formation of thrombus. Okay, so you need to simply write that either it is good or bad. Definitely bad for us. And next is the micro massage. I have already explained, I have repeated this diagram a lot of times. You need to focus that when the size of crystal is this, these are three cells. Okay, and when the size of crystal increased, the cells get compressed, and again the size become normal, the position of cells is again normal. But when the size of crystal reduced, you need to see that the cells moved apart. This produces a micro massaging effect, which is helpful to reduce the edema. Okay, helpful to reduce the edema. How it is produced? Due to the back and forth movement of crystal transmitted to metal front plate, helpful to reduce edema. Okay, so this is about the non-thermal effects. So till now we have completed the thermal and non-thermal effects. Now we are moving toward the biological effects of ultrasound. Now we are going to study about the biological effects. Okay, so these are the effects which are related to the biological process of healing. Okay, that is the effect on the overall healing process. Okay, so it is having three phases. First is the acute phase, also called the inflammatory phase. Second is proliferative or granulation phase. Third is the remodeling phase. Okay, so it is simple to understand. You need to focus on the important terms. Okay, So the SC and AS means stable cavitation and acoustic streaming. As we have studied that stable cavitation and acoustic streaming increase the calcium influx. Okay, so calcium का influx क्या होगा? Increase हो रहा हो. And if we know that it is acting as a second messenger, due to this there is an increased production and release of growth factor, that is the healing factor, which increase the healing. Also in pulse mode, okay, in pulse mode we are going to have a thermal effect which is causing vasoconstriction, which further reduce the blood flow and reduce the swelling. But in the continuous mode it is causing vasodilation and increase in the blood flow, which increase nutrition and oxygen at the site of injury to increase the healing. That is 2-3 mechanisms are used. First is the use of acoustic streaming and stable cavitation, which increase the influx of calcium ions and other ions, which are acting as second messenger, which increase the production as well as the release of growth factor and increase the healing. और pulse mode में जहां पर क्या है, a thermal effect cause the vasoconstriction, reduce the blood flow, further reduce the swelling. But in case of continuous mode, it increase the blood flow by the vasodilation, okay, and it increase the nutrition and oxygen at the site. Next is the proliferative or the granulation stage. It began 3 days after the injury. So our injury is now 3 days. Now the stage is 3 days after the injury. Okay. Now fibroblast will come into play. That is, it will lay down the granulation tissue. Okay. So fibroblast lay down the connective tissue, that is granulation tissue, and angiogenesis will occur, which is formation of blood vessel. Ultrasound, if we apply in this phase, help to stimulate the fibroblast, and these fibroblasts will further produce more collagen. Not only the quality but quantity, not only the quantity but quality also improve. That is, first thing is that fibroblast will produce a lot of collagen. Second thing is that the collagen will be of a high tensile strength. Okay, so the collagen is of greater tensile strength is produced. Further, it stimulates the reepithelialization, granulation tissue formation, and wound contraction, lead to the formation of good scar. And now one more important point related to the bony healing is that ultrasound, if applied in the first 2 weeks of injury of the bone, help to increase the bone healing. But if it is applied on the unstable fracture, okay, if it is given to the unstable fracture during the phase of cartilage proliferation, that is the endochondral changes. Okay, जरा कौन आ गया? यार मैं बात देख दूंगा तेरा. Now the more important point which is related to the bony healing is that when ultrasound is applied in the first 2 weeks of injury, it increase the bony union. But if given to the unstable fracture during the cartilage proliferation, okay, cartilage proliferation, here it delay the bony union. Okay, in this stage the bony union is reduced. Okay, so you need to first check by the use of x-rays, that x-ray and the time of injury. So another important point which is related to the bony healing is that if the ultrasound is applied in the first 2 weeks, it is good and it increase the bony union. But if it is given in the stage of cartilage formation, okay, that is endochondral ossification, which occur at about 4 to 6th week, there it increase the formation of cartilage, and further it have a bad effect that it reduce the bony union. Okay, so it reduce the bony union, so it is good to use it at first 2 weeks. Last is the remodeling phase, and this phase lasts from months up to the years also in some cases, up to what, until the new or near normal tissue is produced. So it lasts for the month or year until new tissue or a near normal tissue is produced. And ultrasound is considered to improve the quality of healing and increase the extensibility of collagen. Further, it will help to reduce the scar, okay, by reorientating the collagen fibers. Okay, so this was about this lecture. We are done with the all the effects, that is the thermal effect, then non-thermal effect, and last was the biological effects. With this we are completing the physiological effects of ultrasound. In our next lecture we will study about the therapeutic effect of ultrasound. So till then you keep on studying. Thank you to one and all.